Good afternoon, fellow Barbadians and members of the media. You will recall that on April 14th, I brought the nation up to date on the state of affairs regarding COVID-19. On that occasion, I confirmed the existence of BA.2 variant in Barbados. Today, I'm taking this opportunity to further update you on the status of COVID-19 in Barbados and a new directive which will come into effect from tomorrow. I wish to point out that we are now 2 years and 4 months since our first recorded COVID-19 case. This period has also been a unique learning experience, not only for the average Barbadian, but especially for all categories of public health workers who, it is widely acknowledged, have given yeoman service in guiding the country through these difficult times. As I've previously stated, the Ministry of Health and Wellness is moving steadily ahead with the management of COVID-19. As we do so, I would remind the nation of each Barbadian's own personal responsibility and good judgment in times ahead, in the same way they have cooperated in contributing to the overall success we have recorded with this ongoing battle. Despite our pleasing positive results, I must point out that we cannot afford to drop our standards and behaviors, especially at a time when Barbadians are enjoying the previously announced relaxation of COVID-19 measures. These measures, tough as they sometimes were, and the willingness of Barbadians to support them, were absolutely critical to bringing us to these happier circumstances. To do otherwise, with COVID-19 still changing, will leave the nation open and vulnerable to the possibility of an upsurge. Let me say from the onset that mask wearing, physical distancing, and vaccination with boosters remain the proven public health measures for our protection. Let me remind you that we must continue to have a special duty of care to the most vulnerable members of our society, particularly those needing special care and attention, such as those with non-communicable diseases, immunocompromised, and the elderly. The Ministry of Health and Wellness remains committed to providing guidance and assistance to keep these special citizens safe. On the other hand, I wish to urge all unvaccinated persons in Barbados to improve their protection against COVID-19 by taking full advantage of the thousands of vaccines which are available, rather than allow them to eventually expire and go to waste. Although there will be day-to-day variations in the number of confirmed cases, all of the indicators used to measure the spread of the virus within our communities continue to trend downwards. These include the positivity rate currently at 18%, down from a high of 32%, and the R effective currently at 0.89, down from a high of 1.2 6 weeks ago. Unfortunately, we have lost 473 lives. However, there has been a slowing of the death rate. As to the situation at the Harrison's Point facility, there are presently 28 persons receiving care, which represents a low of 10% of the total occupancy at the facility. Home isolation remains a key strategic component in preventing the spread of infection, and I'm happy to report that the numbers are less than 1,000 persons, and these infections have also been trending downwards. The Emergency Operations Committee met last Monday and reviewed the current directive and made the following recommendations for a new directive which will come into effect tomorrow. These changes reflect the prevailing climate in our country and an overall reduction in the case burden. As from tomorrow, there will be no testing or vaccine mandates to take part in community, social, and sporting events, including emancipation and cropover, pleasure craft, private boats, party cruises, nightclubs, karaoke, graduation, and prize-giving ceremonies, to mention a few. Service providers, staff, and performers will no longer be required to be tested or produce evidence that they are fully vaccinated. Gatherings of 250 persons or more will require permission from the COVID Monitoring Unit and the National Cultural Foundation. The restrictions on attendance and the length of service at funeral services, wedding ceremonies, wedding receptions, and religious services will be removed. The mask mandates for indoor events and physical distancing of 3 feet or more are still in effect. For outdoor activities, mask wearing remains optional. Mandatory hand sanitization is required for all public and private healthcare institutions, all educational-based facilities, nursery through tertiary, all ports of entry, and at prison DODs. We will allow no more than one person to visit a patient in a nursing home, senior citizens home, geriatric hospital, or a district hospital. These changes have been implemented after careful consideration and evaluation of the public health risks, both locally and internationally, and the available measures needed to mitigate the impact of COVID-19. Fellow Barbadians, community transmission remains high, and I urge that at all times you take all of the necessary precautions to protect yourself and others around you. At the same time, I wish to remind you that there will continue to be the risk of new variants within our population. We will continue to provide the appropriate surveillance for new and emerging variants, for example, Omicron B4 and B5, through our technical cooperation with the Caribbean Public Health Agency, CARPHA, and the Pan American Health Organization, PAHO. We are reviewing our travel protocols at our ports of entry to reflect the need for further relaxation of requirements for entry while protecting the health of our citizens. These changes will be communicated after consultation with our stakeholders. I would like to thank you for your continued cooperation and vigilance. But let me caution that COVID-19 remains a global health threat and new variants will emerge from time to time. We are certainly not in the clear yet as it relates to COVID-19, but our personal behavior and long-held Barbadian values will continue to help us in our fight against COVID-19. The Ministry of Health and Wellness, through the combined expertise of its public health officials, will continue to provide advice and strategic public health interventions to protect the public as we continue to ride the many waves of COVID-19. In this season of emancipation, we must let personal responsibility be our guide to an enjoyable and safe crop over. We therefore encourage you to continue to follow the guidance from the Ministry of Health and Wellness. It is in these promising circumstances that I wish all full enjoyment of our festivities as we once again are able to be outside. Spread the message, not the virus. Thank you.
A pleasant good afternoon to all listening to this broadcast. Globally, the number of new weekly cases has continued to decline since the peak in January 2022. Reported cases and deaths have now both fallen more than 90% from their peaks earlier this year. In Barbados, currently none of the community transmission indicators reflect medically significant disease or healthcare strain. This is a very welcome trend. It is within this context that a change in the directives has been supported. At this time, I, however, wish to remind you that within the last 5 days, we have had a total of 700 cases. We therefore cannot allow ourselves to become numb to these numbers. It is in this regard that the Ministry of Health and Wellness continues to highly recommend vaccination, boosting, testing, isolation, to slow transmission and to protect persons against poor outcomes, hospitalization, and deaths. We are committed to managing the issue now and in the future, and we will continue to support every Barbadian in getting through the COVID pandemic. As we have indicated, we have moved to a situation with living with COVID, and therefore it is critical that persons assess their risks, assess their vulnerabilities, and make important personal choices that will reflect not only with themselves, but their close persons around them and their families. The Ministry of Health will endeavor to continue to manage the situation. Currently, we have an outbreak at the psychiatric hospital, which is contained. I am happy to report, with respect to the prisons services and inmates at the prison's DODs, that situation is under control and that outbreak is over. We have had no reported cases within nursing homes and senior citizens' homes. So we will continue to manage the situation as we see fit and always be available to the public to give good advice. My last parting message is that we again urge persons that based on what we know with respect to the virus, that boosting offers your best protection. So if you had 2 vaccines before, that is certainly not enough, particularly as new strains come on board. We are asking you to go out and get boosted. Thank you so much.